So UChicago medicine has a very rich and long history of transplantation. Heart transplant has taken on that tradition and now has become one of the leading programs in the country under the banner of UChicago medicine. It is very rare for a program to have the highest survival rates in the country, which we have had over the last 2 years, and at the same time have the shortest wait time for organs. And historically, no one's ever been the best at both. And UChicago's program over the last 3 years has been the best both in wait times, the shortest wait times, and in survival.
The way we achieve such short wait times at the University of Chicago is multifactorial. The first thing, from a recipient standpoint, we bring people in the hospital at the time where they're most likely to get transplanted, when they're most ill and ready for transplant. The second thing is, in terms of our donor selection, we have a very aggressive approach to selecting and taking donors that other centers may decline. We're willing to travel very large distances and use some fairly advanced technology to allow us to extend preservation time and accept organs from all over the United States.
We asked the question of, how can we make you a transplant candidate? And whereas maybe other programs look at it as, are you a transplant candidate here? We really go out of our way to make sure that we can do everything that we can so that the patient is a transplant candidate. And that goes from multiple ways. That's from clinically, can we optimize you to make sure that you go into surgery as best as possible? Can we educate you and make sure that you know how to get your medications, what your medications are? Do you have the social support that you need? We really kind of go at it from all different sides.
Sensitization in heart transplantation is when a patient has an immune response that has created antibodies in their body, antibodies that can reject a potential organ, and can get to the point where a highly sensitized patient is no longer able to receive any organ. And what we do at UChicago Medicine is we take those individuals and evaluate them and do what we can to try and find organs for them to give them a chance at being an organ transplant recipient. Sometimes it's a matter of medications that we can give to challenge the immune system, to suppress the immune system and reduce those antibodies that individual has. It is often also a combination of using diagnostic testing, special tests that we have learned to use to try and quantify which antibodies are the ones that we really need to stay away from. And oftentimes it's a combination of these strategies that really helps us identify an organ that can be transplanted into our recipient.
We do roughly, it depends on the year, but UChicago Medicine does roughly about 60 transplants a year, and about 25% of that volume are multi-organ transplants. The majority of those are heart-kidney transplants, but you also do a number of heart-liver transplants and heart-liver-kidney transplants. And I think what it comes down to is that we have a really collaborative, multidisciplinary team of surgeons, physicians, nurses, nurse practitioners, pharmacists, social workers who work together really well, not only in cardiology and cardiac surgery, but across all disciplines. And so I think it comes down to communication and trust. I think that really lends to our ability to take on these really complicated cases and do multi-organ transplant successfully. We've started to sort of push into bloodless multi-organ transplants, and I do think over the next couple of years we'll find sort of new frontiers and new boundaries.
I came to the University of Chicago in the fall of 2018. I had been being worked up for a heart, liver, and kidney transplant. We met with Dr. Jeevanandam, and we were extremely hopeful that he thought it would be a success. I loved how we immediately became a family, and we became very hopeful and optimistic and positive that the staff here was gonna make this work, and all their expertise and professionalism was really gonna pull through. And now I'm doing fantastic. I really have no restrictions from the team. I am working 40 hours a week here at the hospital, and I have completed in a bunch of 5Ks and the Hustle, which is the John Hancock stair climber of 94 flights. Just great.
I think we ensure the best outcomes for patients in our program because we're really able to address all of their needs. It's not just one specific thing, like we're just addressing their heart. It's really holistic, and so we're able to clinically manage them, we're able to give them a lot of education, we're able to socially support them, psychosocially and psychologically, and then whatever other help they need, we're able to really cater to their specific needs for each patient.
At the University of Chicago Medicine's heart transplant program, we continue to innovate. We're working very hard in the field of donation after circulatory death. We're also working with xenotransplantation, which is transplanting pigs into humans. And we're working very hard in the field of how do you get a patient to a transplant. And we're continuing to innovate with micro assist devices to get patients to transplant. So all that combined, we're allowing people to live a much better life and a longer life.